We interrupt your regularly scheduled programming as Governor Charlie Baker is providing an update on the COVID-19 situation in the Commonwealth. His press conference is just beginning. Let's listen in.
Earlier this morning, we announced several actions to combat COVID-19 in the Commonwealth. The Massachusetts National Guard will once again answer the call to assist residents. Hospitals across Massachusetts are experiencing an unprecedented demand, and there remains a critical staffing shortage in many jobs and many roles to meet the needs of our patients. We're committed to ensuring our healthcare system meets the acute care needs of our residents. To support hospitals that are experiencing staffing shortages, the Governor is activating up to 500 members of the Massachusetts National Guard to ensure sufficient non-medical personnel are available to deliver support to patients. This will allow hospitals to free up clinical staff to provide higher levels of care to those who need it. Beginning with training this week, 300 of these Guard members will support 55 acute care hospitals as well as 12 ambulance service providers to address the non-medical support needs of our hospitals and transport systems. They will be on site Monday. These non-medical Guard personnel will serve in roles such as non-emergency transport between facilities, like transporting a patient from a hospital to a nursing home, assistance transferring patients between, bringing the patient being discharged from a hospital to a nursing home, patient observers providing continuous or frequent observation of a patient who is at risk to harm or themselves, security support to help maintain a safe workplace, in-hospital transport, bringing a patient via wheelchair or, if needed, a stretcher from their patient room to tests such as x-rays or a CT scan, or from the emergency department to their inpatient floor, and food service, delivering patient meals. Additionally, to further address the critical staffing shortages in our hospitals, the Department of Public Health has released updated guidance to hospitals regarding non-essential elective invasive procedures. Effective 12:01 a.m. on December 27th, all hospitals are directed to postpone or cancel all non-essential elective procedures likely to result in an inpatient admission in order to maintain and increase inpatient capacity. I want to be clear, our hospitals remain ready to care for the urgent needs of the residents of the Commonwealth. In response to the rise in cases and hospitalizations we are seeing in the Commonwealth, and as we learn more about the emerging Omicron variant, the Department of Public Health advises that all residents, regardless of vaccination status, wear a mask or face covering when indoors and not in their own home. We particularly urge this recommendation if you have a weakened immune system or if you are at increased risk for severe disease because of your age or an underlying medical condition, or if someone in your household has a weakened immune system, is at increased risk for severe disease, or unvaccinated. I know we are all feeling the pangs of pandemic fatigue, but as we all prepare to gather with our loved ones, a tradition long overdue and has been interrupted by the COVID-19 pandemic, it's important for all of us to remember that the vaccine and boosters are highly effective at protecting against serious illness, hospitalization, and death. The best possible gift you can give to your loved ones this season is protection from COVID. Get vaccinated, get boosted, and have a safe holiday. Thank you. With that, I'll turn it over to the Governor.
Thanks, Secretary. To the Massachusetts healthcare community, to the doctors, nurses, technicians, specialists of all sorts, and every person who reports to work in a healthcare setting, thank you on behalf of the people of the Commonwealth of Massachusetts. You're working in wildly challenging and difficult times and circumstances. What we announce today will hopefully allow you to serve your patients more effectively. The Massachusetts National Guard is also due a tremendous thank you. From getting kids to school to protecting small businesses to now helping our healthcare providers, these citizen soldiers answer every call. The jobs and commitments they leave to serve us are real, and we're deeply grateful for it. There's no question the next few weeks will be enormously difficult for our healthcare community. There are staff shortages, sicker patients, and fewer step-down beds available, again, because of those staff shortages. The steps we're announcing today are designed to support them so that they can continue to care for patients. We also know there's some anxiety out there with talk of rising cases, breakthrough cases, and variants. Throughout the course of this pandemic, there's been no shortage of hypotheticals, no shortage of worst-case scenarios to be debated, and no shortage of things we don't yet know the answer to. And it's very easy to get lost in all that. It's also easy to get anxious about all that. But it's critically important that we also remember what we do know for sure. We know that kids are at extremely low risk, and we know that going to school is safe, and in many cases, it's also healthy for children to be with each other and with trained, caring adults. We know vaccines work. We know that out of the 5 million people in Massachusetts who are fully vaccinated, only 2% have gotten COVID. We know that among all the breakthrough cases in Massachusetts, 97% of them never end up in a hospital. And we know that of the 1.2 million people over the age of 12 and under the age of 30 who've got vaccinated, not one has died from COVID. We know that of the nearly 2.5 million people under the age of 60, less than 1% of these people, in fact, 0.1% of them have died from COVID. And we know for those over 60 who got vaccinated, less than 3% of them have died from COVID. And we also know that almost 2 million people in Massachusetts have already received a third dose. We also know that unvaccinated people are 31 times more likely to just test positive than someone with that third dose. We also know that the vast majority of the people in the hospital with COVID are not vaccinated. All that means, among other things, is that we know for sure that vaccines offer tremendous protection from illness, better than any other measure. We also know testing works. Rapid at-home tests taken before you get together with people outside your household can prevent transmission. They offer a little more peace of mind this holiday season, too. And the hundreds of testing sites around the state can do the same. We also know wearing a mask can help. If people want to take an extra step, everyone knows they can put on a mask in a crowded indoor place. We updated the face covering advisory today to urge all residents to wear a mask in public indoor spaces. We'll continue to release the best public health directives we have so people can make informed decisions about how to protect themselves. Obviously, our administration will continue to support cities and towns and businesses that adopt additional protocols. Vaccines and all the other resources we now have available and know for certain that they work are far more important than any hypothetical question that we may not yet know the answer to. For the foreseeable future, Massachusetts and most of the country will see large numbers of new cases. But a new case today does not mean the same thing a new case meant a year ago. The therapies and vaccines that offer near universal protection did not exist a year ago. Vaccinated people may test positive, but their chances of dying or getting seriously ill are so small they pale in comparison to so many riskier behaviors out there. We should not lose sight of this. Yes, cases may go up, but if you're vaccinated, your risk stays the same. That is extremely low. And if you're boosted, your risk of getting sick is even lower. The holiday season is here, and opportunities to share special moments with people we love are also here. The people of Massachusetts sacrifice those moments when hunkering down was truly our only defense. That's no longer the case thanks to the protection afforded to all of us by vaccines. Getting vaccinated and getting a booster if you're eligible is the best thing you can do this holiday season for you and your family. Doing so will help you and your friends and family because it is the single best thing you can do to support yourself, your family, and our healthcare providers. We distributed over 2 million free rapid tests for people here in the Commonwealth in many of the communities hardest hit by COVID. Those tests are also available at retail, at your local pharmacy, at many other locations, and you can also purchase them online. Use them before you get together with friends and others. Let me say that again. You can buy a cheap do-it-yourself test at CVS, Walgreens, Walmart, or online, and use those tests before you get together with others in big groups. In addition to at-home tests, our testing sites in Massachusetts continue to be available and are very busy, delivering over 100,000 tests a day for the past several weeks. The testing tools, vaccinations, and many of the other tools we have make it possible for people to gather safely. We just need to use them and use them appropriately. It's no secret that all the time we spent away from family and away from friends and away from the classroom had a negative impact on some of us. But back then, it really was our only defense. The Commonwealth is home to strong and intelligent people, but no one is immune to the anxiety and the mental health struggles that have been brought on by all this isolation and loss of physical presence that has come with the pandemic. Please, if you're struggling, reach out to a friend or a family member or reach out to a healthcare provider. If you know someone who you think may be struggling, reach out to them. They are sure to appreciate it. And please get your information about COVID from a trusted source like your doctor or a medical institution, or the Department of Public Health, or your local Board of Health. And to all of the people in Massachusetts who have done their jobs throughout the course of this pandemic, we need you to do another one, to be there for your friends and your family, and to offer a helping hand through the course of this holiday season. People are anxious. That's normal given everything we've been through. But what we know about this virus, what we know about how to protect ourselves, and what we know about the character of the people in Massachusetts should give us all cause for pause and a sense of relief. Thanks to so many people, Massachusetts is one of the most highly vaccinated states in the country, and the evidence is overwhelming that these shots work. We've made tremendous progress by doing the things that Massachusetts knows well: following the data, looking out for one another, supporting one another, and being there for family and friends. That game plan is working, and we should stay with it. And with that, questions for me or the Secretary?
And that was Governor Charlie Baker giving a COVID-19 update. He said the Commonwealth's healthcare system is facing a critical staffing shortage. So in response, up to 500 members of the Massachusetts National Guard will be activated to address the non-clinical support needs. And effective at 12:01 a.m. on December 27th, all hospitals will postpone or cancel all non-essential elective procedures. Out of 5 million people vaccinated in the state, the governor said only about 2% have contracted the virus. He went on to say that the Department of Public Health says 97% of COVID breakthrough cases in Massachusetts have not resulted in hospitalization or death. And the DPH released an updated mask advisory today, recommending that all individuals, regardless of vaccination status, wear a mask or face covering in indoor public spaces. To continue watching this press conference, you can download our free Western Mass News app, and you can tune into Western Mass News at noon on ABC 40 for the latest update.